Cystic echinococcus, a disease that you get from your dog. Let's have a quick look at what this is. This is a parasite that comes from intimately touching your dog, contacting things that have contacted the dog feces. Here's a little picture that you can pause and look at. Here we are at CDC, the main page for this disease. In blue highlight, cystic echinococcus, also known as hydatid disease, is caused by infection with the larval stage of Echinococcus granulosus, a tapeworm found in dogs, sheep, cattle, goats, and pigs. Most infections in humans are asymptomatic. Cystic echinococcus causes harmful, slowly enlarging cysts in the liver, lungs, and other organs that often grow unnoticed and neglected for years. So these cysts slowly grow and cause problems, and then eventually they break open, and you can have one of these tapeworms wrapped around your lung or in other organs of your body. Now, this parasite can also get into the alveolar parts of your body and cause alveolar echinococcus. And these cysts and parasites get in the liver, lungs, brain, and other organs, including the eyes. So this can cause two very dangerous diseases, all from one tapeworm. You got cystic and alveolar. So let's look at some of the other stuff they have about it. Epidemiology and risk factors. Okay, risk factors. The parasite is transmitted to dogs when they ingest the organs of other animals that contain the cysts. The cysts develop into tapeworms in the dog, and the dogs shed the tapeworms in their feces and then contaminate the ground. And not just the ground, anything that touches the feces, the particles. And in modern America, that would be our couches, our faces, everything touches dogs. And the same thing is true for the other echinococcus. Dogs ingesting food or water that's contaminated with the tapeworm eggs. So we've got a few different little side paths on here. Everything will be in the description for you to look at. One of the things that is interesting about this, or perhaps we should say concerning, is it does get into the brain. And there are a lot of stories about these cysts showing up in people's brains, and then they think they have tumors, and they either just allow the human to die, or they go and look at the tumor and they find an actual tapeworm in there. In the description, I'll put some of those stories for you to check out. There was even a police officer that died because they thought he had brain cancer, but they didn't actually look and see if it was one of these type of cysts with the worms in it, like they have with other people. And that police officer died, and he was a police officer that had a little dog with him for like 20 years while he was on the police force. They called it a canine chihuahua, and they said that that dog and him were like husband and wife. So there's a very good chance that that dog could have given him one of these. Okay, now let's have a look at a story that I found about these liver parasites. Now, these types of stories are harder to find because they don't very often mention the risk factor of dogs, but this person does. So allow me to share this with you. So I got the closed captions up so you can see what they say about the parasite.
Hydatid disease since he was a little boy.
The entire family is immigrated from Yemen a long time ago. As a child, he unfortunately got this disease from their dogs down
Got the disease from their dogs.
in Yemen.
Hydatid disease, or cystic echinococcus, is caused by infection of a long tapeworm found mainly in dogs and also in sheep, cattle, goats, and pigs.
When the dog eats a home slaughtered meat or livestock that is infected, gets infected with this tapeworm. It lives inside dog's body and creates eggs that come out of dog's feces. If a child, a young person, or an adult eats food, herbs, greens, anything that is infected with the dog feces, or even intimately pets a dog that is infected.
He said intimately pets a dog that is infected. So he's talking about getting particles just directly off the dog. And what does he mean by intimately petting? What's his deal? What's he talking about? I'm going to guess this is what he's talking about. You know, right now, people live with their dogs and give their dogs puppy kisses, belly rubs. You know, they get into close contact with the dog's genitalia, the slobber, and the everything else. So I'm thinking that this is what the doctor's talking about. Intimate petting.
Those with CE may never show any symptoms, but it can cause harmful, slowly enlarging cysts in the liver, lungs, and other organs that.
That's right off the CDC page. So this isn't just a hepatic problem. This isn't just a liver problem. Wherever those little particles get in your body, that's where that parasite is going to stay and make its home. Now, they say that there's no symptoms until these things hatch or get big enough. But that's not necessarily true. If something is growing inside of your body, it has to hide from your immune system. If you've taken even a basic human biology class, you know that anything that goes in your body is triggered by your immune system. And there's a lot of diseases such as autoimmune disease, like rheumatoid arthritis, and other sicknesses that are related to autoimmune disease where our immune system isn't functioning properly. If these little cysts have to hide a tapeworm, they have to hijack our immune system. They have to change the way that genes are expressed in our body. So perhaps there's no acute symptoms, but I bet that these cysts that slowly grow and communicate with our immune system to hide themselves are probably causing all kinds of small downstream problems.
Grow unnoticed and neglected for years. Though the patient wished to remain anonymous, he says he suffered severe discomfort in his upper abdomen.
The major thing was the pain, fevers, and the conglomeration of the infectious system.
So Dr. Fauci had to think outside.
So he did have other symptoms, not just the fact that the parasite was there. Kind of funny they called this guy Dr. Fauci. That's not his actual name. Sometimes the closed captions don't quite work. But let's continue.
Side of the box and come up with a treatment and surgery plan never seen or done in the Central Valley.
It's a very risky, dangerous surgery because when you operate on the liver, if these parasites get free or basically broken down, the cyst that they live in breaks down, there's a.
So the parasite lives within the cyst. And this is probably why they don't just do exploratory surgery when someone has a problem, because breaking the cyst open is very, very risky for these doctors. So here's a quick picture of the echinococcal cyst. These are the little parasite eggs. So if they open your liver to remove this, there's a chance that these eggs can go somewhere else, and now you got a cyst somewhere else. So that's probably why they don't really diagnose or test for this, because this is going to be, as that doctor said, it's going to be out of the box thinking, risky surgery. Let's finish up with the doctor's advice.
May be around dogs.
Try not to pet dogs that you don't know. Second, if you're in direct contact with the dogs that you're not sure where they're coming from, or if their vaccinations are up to date, or if they're eating the food that they have to eat, then wash your hands thoroughly.
The disease is found in
So that has been our quick look at Echinococcus. Here's some prevention and control advice. What kind of prevention and control advice do you guys think we should follow? Maybe stay away from dogs? Let me know in the comments. See you guys in the next one.